All right. Let's see. All right. Can everyone hear me okay in the back? Excellent. Okay. Well, yeah, thanks, Holly, Gary, for having me here. Always great to be on the island. So today I'll be talking about vacuum therapy for penile rehabilitation. Now, Worthy Health is the educational platform that I represent. It's aimed at destigmatizing sexual health, and the goal is to provide Canadians with access to trusted education, high quality therapeutics, and all the information we're presenting here is overseen by our medical advisory board. So Gary already gave the intro on me, so I'll skip over that. Nothing to see. This is our medical advisory board, though. We've got our medical director is Dr. Stuart Oak, a urologist out of Ottawa. And then our two main advisors are Christine Zarowski, who worked to mainly put together this presentation, and then Dr. Stacey Elliott. So our whole thing is feedback from real cancer survivors. I'm sure like a lot of folks here in the room. The three kind of main themes that we started to hear over the past 2 years were lack of support from surgery to recovery, lack of centralized education, and then lack of access to devices and products for ED and incontinence. Now, there's now wonderful programs like the Island Prostate Center filling that gap for support, for education. So the one, given my background, our team's background, it was devices and products where we wanted to bring that to the forefront, and sessions like this, giving education around it. So quick little rundown of the presentation. Tried to keep it pretty brief. Appreciate everyone coming out too on this Thursday night. So we'll start with the dimensions of human wellness. We'll get into what is vacuum therapy, a bit about the radical prostatectomy and ED. I'm not a medical professional, so that's just from our nursing and medical team, a bit of a background there. Importance of penile rehab. We'll talk about how to use a VED. I've got a video. Can I play the video? That should work, right? I'll give it a whirl. And then combination therapy we'll talk about as well. Demo units are over there. That pump there is the main one we'll be focusing on today. So dimensions of wellness, you've got your classic 8 dimensions, but there's one that's missing here. That's sexual well-being. It's often neglected, and we know now that when that's not being met, all the other ones start to fall, and that's why it's just so important. What is vacuum therapy? That's why we're all here. That's the crux of this presentation. It's negative pressure to bring blood flow to the penis in a safe and effective way. It's drug-free, works to create an erection 90% of men. 2 terms that we'll be using today are VED, is a vacuum erection device. That's when there's no constriction rings. And then VCD is a vacuum constriction device. That's when we're using the pump with a constriction ring that's there to hold the blood in. So I'll quickly hold this off. So this is the Osbon steam manual VED, and then this is a classic constriction ring that would go on the base of the penis to hold the blood in. So we'll get back to this later when we get to the show and tell portion of the presentation. So vacuum therapy with the VED, you'll just recommend no constriction rings for at least 2 weeks. Often it's thought of as daily physiotherapy for your penis. Increasing the blood oxygenation post-surgery is key for recovery. And then the constriction device, the ring, is added later. That's usually only when it's used for intercourse. The history of vacuum therapy. Fun fact, it's actually the oldest therapy used for male sexual function among all the approved modalities. Almost 150 years old. Can't imagine what they look like back then, but they've come a long way, and it was adopted by the AUA as a standard of care in 1996, and you'll see it in the CUA clinical guidelines for ED right there with injections. Kerri's bread and butter that she'll be getting into later. So VEDs, however, they took a backseat when PD5Is aka Viagra, became mainstream. Why? Because the pill is just much more convenient. However, we're seeing a resurgence as of about 10 years ago of VED popularity and adoption. Now, I'm gonna, just some studies that our medical team put forth. I don't want to bore anyone, so we'll kind of just glaze over them. This was one of the main studies, 2010, where VCD therapy established as an alternative for ED therapy when the PDE5 failed, and kind of recognized as an indispensable modality for ED and related conditions. This is the return of VEDs that we've seen in the past decade. The efficacy is high, no serious side effects or drug interactions, and the combination therapy. So it can be used alongside pills, used alongside injections. And I mean, arguably, it's one of the more cost-effective options. It's a one-time investment as opposed to the continual spend of the other ones. Radical prostatectomy and ED. Again, I'm not an expert here. This is provided by our medical team, but there's that ED after radical prostatectomy that can be common nerve damage, structural tissue damage, cavernous oxygenation or lack thereof, and arterial damage. So this was a really interesting study from 2018 where often, and that's the early use of vacuum therapy as an effective strategy for improving ED and penile shrinkage in post-radical prostatectomy men. And then it even cites when it's combined with the pills, the benefits were significantly enhanced. Another study were citing a significant improvement in penile oxygen saturation, and that's from 2014. So one of the themes that I thought was very interesting is that, with the increase in detection of prostate cancer in younger men, it's kind of shifted the management of the disease where, better detection is better survival rate, which is awesome. That's what we're always going for. But now it's shifting from less of a mortality management to a lifestyle management where, if we're picking up prostate cancer in younger men, now it's like, okay, now we're dealing with the ED and the incontinence as they have, 30, 40 plus years to live. The issue is many men remain silent about it because, as a man, it's not easy to admit to this or even talk about it. So the importance of penile rehab following radical prostatectomy. As we stated earlier, that nerve damage during the prostatectomy, early intervention is proven to be crucial. And one of the ways to do that is bringing oxygenated blood flow to the region on a regular basis. This is proven to help preserve both length and function. And I mean, so this is a study, interesting one from 2009, where the VED, its ability to draw blood into the penis regardless of nerve disturbance has made it made a centerpiece of penile rehab protocols. So there's no disturbance needed. It's not like there needs stimulation. It's using the mechanics of vacuum to bring that blood in. Another study, this one just showing that preserving penile health and length after surgery with early intervention. And this was 30 days. The test subjects were 30 days post radical prostatectomy, and then using the VED daily. And it's same thing 1 month after RP. Radical prostatectomy improves sexual function and helps to preserve penile length. A study out of Germany. So I'm gonna try and share this video here. See if it works. This one was made with Prostate Cancer Canada in collaboration with them, a fellow by the name of Lou, a sexual health counselor. This is hooked up to the internet, right? Hope we don't get hit with any ads here then. YouTube these days just riddled with ads. All right, here we go. So it's a little 8-minute video, but he does an excellent job of how to use the device. All right, let me just skip this vid and I'll just do a quick explanation of it in the interest of time. Okay, so gonna wing it here. How to use a VED. Lou does a better job than me, but we'll breeze through it. So the key at the start, referred to by urologists, is called practice sessions, and all that means is that we're using the pump without the rings. We're not using it for intercourse at the start. Most of our urologist partners will have patients using the VED for 2 weeks minimum without a ring, just because it's a different sensation when you're using the VED to bring blood in. It's a mechanical erection. It's a bit of a different erection, and but like anything, it takes practice. 10 minutes per day, 5 minutes twice per day is optimal. And as Lou describes in the video, it's all about going slow. So you're doing 2 to 3 pumps, waiting 5 seconds, 2 to 3 pumps, waiting 5 seconds. And often, it takes a while, and you might not create a full erection at the start for the first few days, even week, even because if you go too fast, it can create a lot of discomfort. But as you can see, it does create a pretty strong vacuum with the device. So the device itself, you've got the pump handle. There's a green button here, the vacuum release button. That's key. If things ever get uncomfortable, you just hit this button and the air just comes right out. The insert here, it's removable to adjust for size and girth depending on the individual. So if you take it out, you got more space, and there's even an inside one you can take out. It's kind of like 3 sizes. Lubricant is key. When you buy a kit, it comes with 4 rings, A, B, C, and D, and then a bottle of lubricant. You want to use a lot of that lubricant all around the base here. That'll help create the seal, and then even inside, so that the penis can slide along it as it becomes engorged with blood and gets up to size. And then you'll see in the photo here, pubic hair, that's a big no-no. You got to remove that pubic hair, because otherwise it's hard to create that seal. And if you do create that seal, it's going to be a lot of hair pulling. And as Lou says in his video, unless you like pain, you want to get rid of that hair. So just stealing his jokes. So yeah, so I won't get too much into it, because videos do a lot better. When you purchase the device, you'll watch the video and you'll do the training. Going slow is key. Discomfort, hit the green button, and lift from the floor. Take a few minutes, and practice sessions are important. And being patient, being consistent, and going slow. And then adding the tension rings. So after 2 weeks of VED use, the patient has the option, if things are going well, they'll be able to create an erection to use the tension rings, or as Lou calls it in his video, fun time. And it's if you buy an Osbon kit, it comes with A, B, C, and D rings. And the whole thing is that you want to start with the A. It's the largest with the least amount of tension. and then if that doesn't work to hold an erection, then you go to the B, which is a little bit more attention, and the C, a little bit more attention, because the goal is you want to see how can I maintain an erection the least amount of tension possible, because you don't want it to be painful or uncomfortable. Yeah, loading the rings, won't get too much into that. So this is a great table from a multi-year study in, I think it was Ireland, the hospital. And, it does a good job of laying out the advantages and disadvantages. Because one thing as a presenter in Worthy Health, we try and, be unbiased or education is, there's disadvantages and there's advantages. Like nothing's a silver bullet. So disadvantages is a bit of instability at the base when you're using this tension ring because, it's holding the blood in, and below it, there's going to be a little bit less hard. It can create a cool erection because the blood is being held in there. Inability to ejaculate if the ring is too tight. And yeah, it's bulky and discreet. It can be a little messy, a little bit of learning curve to use. Advantages though, quick to use, it's reliable, non-invasive. Couples will often incorporate it into foreplay. It can break past that stigma. One-time purchasing cost, lasts long, and then the big one, there's few contraindications. So common issues, it does take a lot of time and patience. It can be painful if you're going too fast, and the hinge effect, and it can feel a bit mechanical. You're using this device to create an erection, which men always say, well, it used to happen so spontaneously. So combination therapy is when you're combining. Typically, it refers to combining the pills with the vacuum therapy. Become quite popular over the last 15 years, but you can also combine the VED with injections. And it's an excellent way to address non-responders to the drugs or lack of efficacy in either or. A lot of studies, especially in the last 5 to 6 years, on the success of combination therapy, especially in those who the pills alone failed, as the pill is the first line for ED. Unless there's a contraindication. Another study here on erectile function, penile length. This one, combination therapy, 5 milligrams of tadalafil once a day with a VED. So last, we'll talk about VEDs in Canada. So this is one of the more common ones on Amazon. Lower price points. The thing about this one is that it's not FDA approved, so it's categorized as a sex toy, not a medical health product. And one of the big things about that is that there's no vacuum limiter valve, so there's nothing preventing it from creating too much pressure. And we often see it's one or the other. Either it's not creating enough because it's just not a high quality pump, or it's creating potentially too much, which can cause damage. Whereas the medical grade VED is much higher price points. FDA approved in the US, possible medical device in Canada, and it has a vacuum limiter valve in it. And everything's medical grade. And the Osbon itself is the most studied and evidence-based one. So something's up, vacuum therapy with a VED, very effective to maintain the health of the penis. Strong evidence to support the return of penile length and function. Cornerstone of penile rehab, increasing oxygen saturation without nerve disturbance, and benefits the sexual health of the individual and the couple. Keys of success. So this is for practitioners. Actually, I meant to take this out, but that's fine. It still applies. Regular use, prolonged use, using it for a longer period of time, supports better results. The gentle approach, goes slow, and then combination therapy is very beneficial, combined with other techniques. It's kind of something to add to your arsenal in your overall sexual health. And last but not least, in support of Island Prostate Center, $15 off all device purchases at osbon.ca, promo code Island Prostate. And that's all for now. And we'll open the floor up and the chat up to questions. Yeah.
So once the gentleman puts that on, how long does it take? Holly approached me to do a talk on on Trimix, and I was like, yeah, sure, why not? And then I thought about it, I'm like, oh man, this is such a sensitive and intimate subject that I only consult with gentlemen alone. So I think it's a real privilege to have everyone, like as a big group, to go over this. My goal is today is to educate you about Trimix in a fun manner. Okay. As you can see with some of my slides, you'll see some funny little images. I want to make it educational, but also lighthearted. And my talk is going to be very interactive. I'm sorry for people that are online. You may not see everything that I am doing, unfortunately, but you can find me at Dr. Nathan Hogue Incorporated. So getting it up with Trimix. I have no disclosures. So my agenda today is go over what is Trimix, who should use Trimix, the Trimix benefits, how to self-administer Trimix injections, and of course the side effects of Trimix. So what is Trimix? Trimix is a prescription drug. You need a prescription, usually from your urologist. A lot of GPs out there don't know what Trimix is. And when some of my patients go to their GP to get a renewal of their Trimix, they're like, I don't know what this is. You need to talk to your urologist. So it's a prescription drug, combination drug that contains 3 medications. Papaverine, phentolamine, and alprazolam. So the 3 components of the drug. So there is papaverine. It enhances the blood flow, which helps to achieve and sustain the erection. Phentolamine is a alpha receptor blocker, which increases blood flow. It obstructs the alpha receptors in the body, causing the muscles to relax, the blood vessels to dilate, and it promotes good circulation. And alprazolam is a vasodilator. It relaxes the muscles. It will widen your blood vessels in the penis and allow continuous blood flow to sustain a good erection. So the combination of these 3 drugs, if it's going to work for you, you should achieve Trimix. Just like the vacuum pump, there's lots of people that can use it. You just don't need to be a prostate cancer patient. So patients that have low testosterone, patients that have cardiovascular disease, patients who have chronic diabetes, especially when their sugars are not controlled, prostate issues, which I'll go over in a minute, depression, anxiety, neurological, spinal cord injury patients, and those who have tried the PDE5 inhibitors. And what those are your Viagra and Cialis. So in regards to the prostate issues, of course, comes along with surgery. So your radical prostatectomy, retropubic prostatectomy. So with that, you can have long-term dysfunction that can occur with the nerves and the blood vessels with damage during surgery. Also with that can happen is, depending on the surgeon and how the surgery goes, is most surgeons, at least that I have worked with, that do a radical retropubic prostatectomy, they always try to do bilateral nerve sparing, okay, for the erectile dysfunction. But depending on how it goes, once the surgeon is in there, this is what I educate all my patients on, is once they're in there, once they see, sometimes those nerves cannot be resected properly. You know, it all depends on the size of the prostate, where the tumor lies, how well the nerves can be dissected from that area. And the goal of the surgeon is, yes, they want to preserve that for you, but at the same time, they don't want to leave any tissue behind. Okay, they want to get all the cells, because the last thing you want is you want to have your radical rich pubic prostatectomy, your what we call an RRP, and have no reoccurrence, right? So their idea is to try to get all the tissue, all the cells. If resection goes well, they can do a bilateral nerve sparing, which is great for the erectile dysfunction, or sometimes they're able to preserve the right side and not the left, or vice versa. But that's something that unfortunately you won't know, or patients won't know until after surgery. After swelling recedes and the area heals, spontaneous erections can occur on their own. But if loss of function is longer than 2 years, it's usually a long-term erectile dysfunction that you are dealing with. The other things that we brought up with prostate cancer is radiation. So when you have radiation in the area, the tissue, the blood vessels can be damaged. Those can happen right away, or those can present years down the road too. And the other part of it, which is not on my slide, is ADT. Some men are put on androgen deprivation therapy, which is essentially an injection that's done for prostate cancer that which some of you may or may not know or have been on it or not. It gets rid of your testosterone in your body, which is the male hormone. But testosterone is also food or fuel for that prostate cancer. So depending on your stage of prostate cancer, some men are on ADT short-term, which then their testosterone can recover, which their erectile function desire to have sexual intercourse or sexual activity comes back. And some men who cannot be off ADT, it is long-term, and they might try things like the vacuum pump or Viagra, Cialis, or Trimix. ADT is, of course, it's not a curative measure for the prostate cancer, it's just managing it. So the benefits of Trimix. So pretty swift onset, prolonged duration. Once you inject Trimix, you should get an erection within 10 to 15 minutes. It is straightforward. It is minimally invasive. However, I have to convince some of you of that, some gentlemen of that, because it is a needle and we are poking the shaft of a penis with a needle. And I think that's one of the biggest hurdles that I come across with gentlemen is, telling them, yeah, you're injecting yourself with a needle, but where you're injecting yourself with a needle. So sometimes they don't, some gentlemen don't see it as minimally invasive, but in the grand scheme of things, it is. And it demonstrates good efficacy. So meaning that most men respond well to Trimix. They do really well. As long as they're trained properly, they know where to inject, they have a good response to the Trimix. So how to self-administer Trimix injections. I found some creative pictures for this when I was working the other day. I have never seen a cloud formation like this, but maybe one day. So preparing and drying up your medication, we're going to go over the prescription itself, the supplies. We're going to go over the dose, choosing an injection site, injecting the medication, and of course, just being aware of the side effect or effect of Trimix. So preparing and drying up the medication with Richard. Hopefully no one is named Richard in this room, but you didn't know what you were signing up for, Richard, but I have my own Richard today. How do I turn this on? Because I have to go over to my table again. So I do this, and then I push this on, right? Yeah. Here we go. I'm sorry, people that are online, you might not see any of this, but hopefully you can hear me. So this is Richard. Maybe in a moment. Yeah. This is Richard. Okay. Lovely display. He's our male model tonight. He does not go by Richard. He goes by Dick. Okay. So I'm going to show you how to compare and draw up the medication of Richard. And I should say we might be able to. Yeah. So they might be able to see. We stop sharing. So prescription wise, like I said, your prescription comes from usually most times your urologist. In your prescription or your Trimix package, as I would call it, you would get your vial of Trimix. Okay, today this is not Trimix, this is a placebo. We don't have the real stuff with us today. You will get a package of needles. Okay, and these are diabetic syringes because what we're injecting and where we're injecting is, a very sensitive area. You don't need a big needle. You don't need a big syringe for where you're injecting. You will get some pills, pseudoephedrine, in other words, Sudafed, okay? Sinus decongestant, cold and flu medication, which I will tell you what this is used for afterwards. And you will get a package of alcohol swabs to go with that, okay? You want to make sure that you have a good clean surface, okay? Diabetic syringes, I can, if you want to, do you want me to pass some of these around so you can actually see how big they are? They're so tiny. I'm gonna leave from the group. And wash your hands. Look, observe, don't touch, don't hold anyone. The purpose of this is so diabetic syringes are used to inject insulin. Insulin comes in units, okay? So what you would see in this syringe is it comes in units. So what you would see on there is 10, 20, 30, 40, 50, all the way up to 100 units, okay? Needle-wise, on your packaging, it's an 8 millimeter, 5/16 in length. You probably can't even see this really from here, okay? That's the length of the needle. That is the standard length of needle that we use for injecting. Every man is built differently though, the shaft of the penis. So some men can bump up to a longer length of needle, but the 5/16 is usually the golden standard. And the gauge of the needle, which you would ever see on a package, is a 30 gauge. 30 meaning the diameter of that needle. The higher the number, the smaller the diameter of that needle. You do not need a large needle to inject what we're injecting and where we're injecting. Okay, just going to recap that for now. So for drawing up your medication, this is our nice Trimix. Okay, you would pull off your cap. You would alcohol swab the top of your vial. Now, I will go over the dose in my next slide. I'm just going to show you how to draw this up quickly, okay? Plunger, in and out nice and easily, okay? So usually with a vial of medication, any vial medication, doesn't have to be Trimix, is usually pressure, vacuum sealed in there. So we need to cause pressure in our vial in order for medication to draw out into a syringe correctly. So how we do that is we put the amount of air into a vial as per the amount of medication we want to achieve to get out into our syringe. So for teaching purposes today, I'll just draw up a tiny bit, okay, say 10 units, okay? Now my syringe and needle are primed with air, ready to put into the vial. Okay, see this, so But simply just push it through the rubber stopper, push your air in. Now, needle is very short. Medication is usually, this one's pretty full, but medication is usually all the way down here. You'd have to flip it upside down and draw back. Okay. Just like the slide says, air bubbles. Air bubbles are our enemy. They're really not. They're not that bad. Okay. You can see, you may not even see this, but there is tiny little surface air bubbles in there, no big deal, okay? Even if you had a big gaping air bubble, no big deal. You need like 1 to 2 IV tubing lengths of air pumped into a vein for it to do anything to you. What I do out of good clinical practice, whatever medication I'm drawing up, I will pull back more than I need, and I will push back any air bubbles right back into that vial. Then at this point, you're not trying to get rid of pesky air bubbles until you get to your desired amount. Flip it right side up, pull it out. Now your needle and syringe are ready for injecting, okay? Trimix itself needs to be kept in the fridge, okay? It needs to be at refrigerator temperature at all times. So if you plan to travel with it, it needs to be at refrigerator temperature, okay? It is a compounded medication. If it gets to room temperature, it will go bad, and you've wasted your money. Trimix is not covered as of yet through extended benefits. I've yet to see one cover it. 1 vial of Trimix runs you about $200, okay? But it's good for about 4 to 6 months worth of injections, okay? And you can use it in combination of things. So you can use it with, if you are using Cialis and Viagra, you can use it. You can use it with a vacuum pump too. We do promote that because the vacuum pump does promote good blood flow to the shaft of the penis, okay? How do I change slides again? The slide, yep. I'm going to switch the slide now. Because now we're actually going to use Richard a little bit. Okay. Thank you for helping me. You don't go back to where you. There we go. Okay. So recap your needle until you're ready to use it. Trimix injection is a clean, sterile technique, okay? Clean being you, because as humans, we are not sterile. The sterile part being that needle, okay? So at any point, if you drop this on any surface, whether you have your medication in it or not, and it does not have its trusty lid on it, you've contaminated. There is no 5-second rule here. That's what I tell patients. There's no, picking up. Oh, it'll be fine. I'm going to inject myself on the side of the penis. Well, if you end up with a skin infection in an area where you don't want a skin infection, I will say I told you so. Okay, so make sure you recap it. Okay. If you're anticipating on using your medication on a certain day, because sometimes it's not very spontaneous, right? When you're with your partner, you're in the moment, you're going to say, hey, hold on. I have to go draw up my medication and get there. You can draw up your medication ahead of time into the syringe. Just make sure you put both of those back in the fridge until you're ready to use this. Any medication out of a vial drawn up into a syringe, you have within 24 hours to use it, okay? Just don't draw it up and leave it on your counter. It's going to get to room temperature and it won't work well for you, okay? So choosing your injection site, okay? So you want to inject the corpus cavernosa, okay? So what that is, if I use Richard here and stretch him out a bit, your corporal bodies are your spongy muscle material that runs down the shaft of the penis on both sides. So that's what naturally engorges with the blood flow in order for you to achieve an erection. We want the medication in to go there. We want it to go in there because we want to promote that good blood flow. We kind of break off the penis like clock. So 12 o'clock, do not inject. 6 o'clock, do not inject, okay? However, you can literally inject yourself anywhere you want or poke yourself anywhere you want on the shaft of the penis with this needle. You will not damage anything. You just will miss the area that you need to inject, and you won't get any benefit from the medication, okay? So usually what we say is between the 1 and the 3 and the 9 and 11 o'clock of the shaft of the penis. When you inject yourself, you're going to lengthen the shaft of the penis out, okay? You want the full length. If you don't do this, the penis tends to be shy. It will hide, okay? It will shrink up, especially when it sees a needle coming towards it, okay? And, you know, penis likes to hide when it's cold, okay? If you don't lengthen it out and it's kind of shrunken in a bit, you will inject the wrong spot. You'll probably inject way too far up on the shaft of the penis, and you will not get benefit from this medication, okay? So you want to make sure you pull it out and to the side, out and whatever side you're going to inject. When you pull it out, you don't want to twist. You don't want to twist because you'll twist the corporal bodies and you could miss when you inject them too, okay? When you inject, you always want to inject sitting or standing, okay? Your bone gravity be your friend, okay? Don't inject yourself lying down. One, it's very difficult to inject yourself lying down. But two, you could have a very supportive partner, which I've seen lots of those, and they're wonderful, that's willing to help with the injections, especially when a gentleman is afraid or doesn't want to inject themselves. Don't let your partner inject you lying down. It will promote the blood flow to go backwards and the medication to go backwards, and you will not achieve an erection. So always inject yourself sitting or standing and stay that way for the duration it takes for you to achieve an erection. Once you inject yourself, you should get an erection within 10 to 15 minutes, okay? And you want to stay that way until you have that full erection. When you inject yourself, it is a 90-degree injection, okay? So what that looks like is just like that, okay? Not like this, not like that, not like that. Right in, okay? And all of that needle is going to go in, okay? Given Dick here, Richard, and the girth of his shaft of the penis, a 5/16 length is okay for him. It will get into the corporal bodies, okay? When you inject, you want to slowly inject the medication. I wasn't going to inject today because this is actually a model of a penile prosthesis in here. So I don't want to poke the cylinders, but when you inject, you want to uncap, of course. You want to hold it like a dart. You do not need to use dart force though, okay? You do not need to play darts. Needles are sharp, okay? And they're sharp for a reason, to be able to glide into the skin really easily. So you would hold it like a dart, you would move your finger, and you would slowly inject, okay? Why I say slowly is because the medication is at refrigerator temperature. It's not a room temperature and it's not a body temperature. So sometimes when you inject things that are cold, it will sting, it stings, okay? You would take out your needle and blood. So if you get blood, no big deal, okay? You haven't done anything. It's like getting your blood drawn. What did they tell you to do? Apply pressure, okay? So apply a pressure to the shaft of the penis for about 60 seconds. Especially those that are on blood thinners, okay? Even baby aspirin. Apply pressure for 60 seconds. If you don't apply pressure, what happens? It bleeds underneath the skin, causing a lovely bruise. I was going to say any questions, but I'll leave that to the end, I guess, but that's okay. So, I can go back to my pedestal if you want to. Sure, I can stay here, whatever you want. I'll just stay. Okay. So side effects, I'm fine, thank you, Holly. So side effects. So one of the side effects of this medication, the big one, is priapism, prolonged erection, okay? An erection that lasts too long. I get some of those men that say to me, what's wrong with that? Like a 4-hour for erection, like that's awesome. Well, no, it's gonna hurt. It's gonna be quite painful after a period of time. Prolonged erection happens in high doses. So, sorry, if I went back to the last slide back here, your dose. I didn't go over that. So your dose, your starting dose for Trimix is usually 30 units. So on your syringe, if you're looking at that, that's 30. Okay. The great thing about this medication is that you can play around with the dose to your liking. Okay. So say maybe you injected 30 units and yeah, you got an erection, but maybe the erection wasn't as firm as you would have liked it, or it didn't last as long as you liked it or wanted it to. The next time around when you can inject yourself, go up to 40 units, okay? Or if you're a little leery, go in between, go 35 units, okay? Work your way up. I always say to gentlemen, don't be discouraged. It could take a good couple months for you to find out what dose works well for you. 30 doesn't work, go up to 40, 50, 60, 70. Now, if you're up in these high doses, 80, 90 units of Trimix, and you're not achieving an erection, the chances of this medication working well for you is not likely. You want to come back, speak with me, come back, speak with your urologist, okay? You never, ever want to go over one full syringe full of this medication. Prolonged erection, let's go back to that. My shoulder is killing me now. Happens in high doses, okay? So don't go, I'm not going to listen to my urologist or my nurse educator and go ahead in your first injection, go inject 60 units. If you end up in emergency with a prolonged erection, you'll get no sympathy from us. We'll tell you we told you so, okay? There is no medication to counteract a prolonged erection when you go there. I know that I thought there was myself, but I learned from one of my girlfriends that works in emergency that she said, no, there isn't. What we do is we stick several needles in the shaft of the penis and we drain the blood for them, okay? So this is why we really stress, and if you come to me ever for teaching, I will stress to you, start low, work your way up, because we want to avoid that. Prolonged erection, just think of it this way, your erectile function vessels are so fine and tiny, and they're just like exploding and gorging with this blood flow. Whatever erectile dysfunction that you might have now, you can make it like 10 times worse with that prolonged erection. You want a happy penis, not a sad penis, okay? So little tricks of the trade to avoid that prolonged erection. Taking the Sudafed tablets. So your Sudafed, this is why you get this in your package, or why gentlemen will get this in their package. You want to take 60 milligrams of that. So after you inject yourself, your erection should be like it was before. It should perform like it did before. After sexual activity or with sexual activity, there's climax, orgasm. What naturally happened before was the erection would go down within 10, 20 minutes. The same idea if you're using the medication. Now, if everything's said and done, you sexual activity, orgasm, and you still have a very firm erection, half an hour, 45 minutes after using Trimix, that's when, number one, you're going to take 60 milligrams of this, okay? Helps dilate the vessels for the blood flow to leave. Second thing, start doing some cardiovascular exercise if you can. Some patients, mobility-wise, it's hard. We want to get your heart rate up, that's why. It naturally releases endorphins for the vessels to dilate. And thirdly, put an ice pack on the penis. Penis hates to be cold, okay? After all those tricks of the trade and you still have a very firm erection after 4 hours, you're going to emergency, okay? Unfortunately. But again, don't start high, start low, okay? So in conclusion, Trimix. You can use your Trimix 3 times a week. You do need 24 hours in between, okay? Even if you inject yourself and you miss where you inject and you don't get an erection, you still gotta wait the 24 hours. Even if you inject yourself at the low dose and it's been half an hour and you still don't have an erection, you can't go top it up, okay? You gotta wait the 24 hours and increase your dose. So if your injection is like you want to do it Monday, Tuesday, Wednesday, you're done for the week, okay? Starting dose 30 units, we usually say. However, if your urologist examines you, goes over your history, and they decide, I want you starting at 10 units, then we will start you lower, okay? Don't get discouraged. That's the other thing. I find some men get discouraged with trying to find the dose, whether you have a partner or not, whether you're going to use the erection or not. I usually say inject yourself. Okay, figure out what dose works for you so that when you're in the moment, say with a partner, there's no disappointment on both ends because it affects you emotionally and intimacy. It can be hard, okay? And follow up with your urologist or your nurse educator. Like I said, when I see my gentlemen on one-on-one or with their partners, I encourage them to come and see me with them. I usually give you a couple months and then I follow up to see how you're making out. With Trimix itself, just to add, there's different strengths. We usually start you with Trimix Standard and there's Trimix Plus and there's Trimix Super. The difference between them, of course, are the concentration of the medication is higher. And of course, the higher concentration of the medication, what comes with that is